I was once asked by a patient when I was going to perform his autopsy. I had such a hard time controlling my laughter while also trying to stay respectful and behave in keeping with the somber nature of the occasion. Autopsy, as you know, is done on dead people. It took me a moment to realize that he meant biopsy. Now, that moment stayed with me because doctors do this all the time. We casually drop medical jargon into conversations, expecting patients to understand what we're talking about, and they don't. And it has nothing to do with intelligence because I've had extremely high functioning bureaucrats look completely dazed because I assume their competence in one field automatically translated into medicine, and it doesn't. So before I drift further, let's talk about what a biopsy actually means. A biopsy simply means taking a small piece of tissue so we know exactly what we're dealing with. Cancer treatment does not start on guesswork. This isn't like a fever where half the time we take a few pills without really knowing what kind of fever it is. There are different ways to do a biopsy, and the method depends on where the problem is. Sometimes the lesion is accessible using image guidance, a CT scan or an ultrasound that tells us where to go and how deep. Sometimes that isn't safe. If the mass is deep in the abdomen and close to major blood vessels, we may choose laparoscopy instead. Sometimes the biopsy is done through the airway using bronchoscopy, sometimes through the food pipe and stomach using endoscopy, or sometimes through the large intestine using colonoscopy, and sometimes with endoscopic ultrasound. The principle is the same every time. We choose the path of least resistance with the lowest risk of complications. There can be more than one way to access the same lesion. In those situations, a PET scan can help us decide which area is the best to biopsy. Then there's the type of biopsy itself. It might be a needle biopsy, it might be an incisional biopsy where only a part of the mass is removed, or an excisional biopsy where the entire lymph node is taken out, which is often the case in conditions like lymphoma. And then there's liquid biopsy. In very elderly patients or those with multiple medical problems, a blood test can sometimes give us the diagnosis by detecting fragments of cancer DNA. And today, the biopsy doesn't just tell us that this is cancer. It tells us how aggressive it is, what mutations it carries, which drugs might work, and which ones won't. Sometimes we biopsy again because when disease comes back, we need to know whether it's the same cancer, a more aggressive version, or something else altogether.